We're delighted to have all of you join us, and just a few housekeeping items before we get underway this afternoon. We would ask that you please ensure that your audio is on mute. And it would be great if you could add your name and the name of any other people that might be joining with you in the same location today to chat. Some of you have already done that. That is fabulous. We will keep chat open throughout the presentation this afternoon. And there will be time at the end for us to take up some questions from you. And if you could pop those questions in chat, that would be just fabulous. You've probably seen the notice on your screen. We are recording this session. And next week, we will be sure to send out a copy of the PowerPoint slides, as well as a link to the recording. And we'll also have some information about long-term care homes that are participating in the RNAO Clinical Pathways program that we'll share with you as well. So that I'm just going to let some more folks in. And our session today, we will be focusing on the integration of the PIECES three-question template in association with the RNAO Dementia and Depression Clinical Pathways. There are a number of pathways. We're going to be talking about those too.
And Joanne, you're going to pull up the PowerPoint.
Oh my goodness. Thank you so very much.
Well, you've been greeting, when you're the greeter. It's
Yes.
a big responsibility.
I don't know that I would get a job as a greeter, but here we are. So I just want to make sure that everyone is in our room. As I mentioned, this work certainly provides opportunities to support best practice and also builds on policies and practices that are already in place in long-term care homes in Ontario. That includes the integration of the PIECES approach and also collaboration with PIECES practitioners. So now that I have the slides on the screen and you can see them, we're thrilled to have Brittany Young joining us today from RNAO. So we will begin with Brittany telling us a few words about herself.
Hi, good afternoon, everyone, and welcome. Thanks, Joanne. My name is Brittany Young. I am the program manager supporting the RNAO Clinical Pathways program, and I am thrilled to be here today. I am a registered nurse by background and have been working with the Registered Nurses Association of Ontario for the last 4 years. Prior to that, I was a director of care in a small rural home in southwestern Ontario. So several years as a director of care and long-term care. So I hold that experience dear to my heart and bring that into the work that I do here. And of course, part of that I was in obstetrics. So, from one end to the other, but really enjoy seniors care and the work that we do at RNAO. And I look forward to sharing more with each of you today.
Great. Thanks so much. I'm Joanne Collins, and I'm with PIECES Canada, and I'm joined today by my colleague Pam Hamilton. I'm a social worker by profession, and I've worked in adult mental health and continuing care for over 30 years. I have been continually inspired by and I have learned from everyone that I've partnered with throughout my career and those that I collaborate with. I have worked with PIECES Canada in some capacity since 2003 and moved into a full-time role in 2022. Pam.
Thanks so much. Hi, everybody. So happy to be here. I've been really very, very fortunate to have worked for, over 4 decades now in shared support of older adults who are living with complexity. And that includes 37 years within seniors' mental health as a clinician, as an educator in development. And I've had the very great privilege of being involved in the PIECES journey since, gosh, since it began back in 1998 and a long-standing member of Pieces Canada. So I'm delighted to be here today.
So the three of us will be sharing information with all of you as we move through our content today. Just before we get started, I would like to recognize that Pieces Canada, the work that we do takes place on traditional Indigenous territories throughout the country. And I'd like to share a land acknowledgement this afternoon, and I'm joining from Nova Scotia. I recognize that I live and work in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq, whose inherent rights were recognized in the peace and friendship treaties. These treaties did not involve the surrender of land and continue to be living agreements that guide our relationships today. I also recognize that African Nova Scotians are distinct people and have shared and enriched that part of Mi'kma'ki known as Nova Scotia for over 400 years. I'm grateful to live and work as a treaty person in Mi'kma'ki. So we'll just quickly look at our agenda for the presentation. We will begin by providing you with some background information about the collaboration, and then invite Brittany to share some very important key messages about the RNAO Clinical Pathways program. Following that, we will highlight the essential messages that are related to the PIECES approach. We'll move into sharing information about the integration of the three-question template in association with the RNAO Dementia and Depression Clinical Pathways. And we'll finish up by looking at some next steps, and we'll absolutely have some time for questions at the end. So this partnership has been quite a wonderful experience. It started back in 2023. And at that time, in October of 23, the BSO Provincial Coordinating Office reached out to Pieces Canada, and they connected us with the RNAO to discuss opportunities to integrate the Pieces three-question template in association with the Dementia Clinical Pathway. Now, at that time, BSO was already partnering with the Dementia Clinical Pathway Working Group, and they were doing that in terms of utilizing the BSO DOS and other BSO tools. We have such wonderful partnerships and collaborations, and both of those organizations viewed partnering with Pieces Canada as an opportunity to meaningfully integrate the PIECES approach into standardized workflows and electronic documentation in long-term care homes across Ontario. And remember, that was in association with the Dementia Clinical Pathway. So in November of that year, we joined the collaborative work that was already well underway. And as the work progressed, it expanded to include the integration of the PIECES approach in association with the depression clinical pathway as well. And that was such a great time in all of those conversations in moving that forward. So we're very honored to be partnering with such a passionate group of professionals with such a depth and breadth of knowledge, skills, and experience, and such tremendous commitment to the best possible care. So it was exciting to have the electronic integration completed last fall, and we then started to think about communication and who we needed to connect with, and that's led us to our presentation here today. And Brittany will now share with us some information about the RNAO clinical pathways and their impact. So there's some really great things that are happening. And this information is good for all of us to know, whether we are working in long-term care or supporting long-term care homes. So I'll turn things over to you now, Brittany.
All right. Thanks, Joanne. So wonderful. I just want to start by providing a bit of information about the program overall. So, for those of you that don't know, the Registered Nurses Association of Ontario is the professional body that represents nursing students, registered nurses, and nurse practitioners across the province of Ontario. And we have many programs within our association that support guideline development, but also the uptake and implementation of best practices. And so one of our newer programs is this program, the RNAO Clinical Pathways. In April 2023, RNAO was funded by the Ministry of Health and Long-Term Care to develop these clinical pathways, and not only develop them, but also support their implementation in long-term care homes across the province to help meet and exceed legislative and regulatory requirements, and really the four key areas listed on the screen. So evidence-based practices, resident-centered care, the required programs, as well as responsive behaviors. Next slide. So the product itself, so the RNAO clinical pathways essentially are digitized versions of RNAO's best practice guidelines. And these versions have been contextualized to the LTC sector. And this work was done, as Joanne mentioned, with the support of a working group. So we've got senior nurses and subject matter experts that have joined our working groups to help us with the development of these clinical pathways. Once these pathways are developed, Point Click Care embeds them within its Nursing Advantage Canada technology, which is a new piece of technology that Point Click Care has. And it has some really great features that have made the clinical pathways very intuitive and easy to use for the nurses in long-term care. I do want to just pause for one moment and just speak to that it's not just nursing staff. We've had questions in the past about the pathways, and they are comprehensive and intended to be done by the interdisciplinary team. So depending on the topic, the clinical topic that we are discussing, there may be other contributors to that assessment. So yes, go ahead there to the next slide. So I want to start by sharing some of the benefits of the admission pathway. So the admission pathway is what we start at the initiation of care into long-term care, and it allows for homes to streamline multiple assessments into one electronic tool. One of our earlier adopter sites found that they were able to replace 15 different assessment forms that they had previously been using on admission. This assessment facilitates a comprehensive assessment of resident risks. So for things like risk for delirium, risk for falls, risk for pain, we're able to facilitate that level of risk during that admission process. It eliminates documentation, double documentation, and really builds on efficiencies. And it also provides information flow, meaning that the responses to similar questions within the admission pathway will flow into other RNAO clinical pathways once they've been implemented. Next slide. Wonderful. So our reach to date, so far we've got 1/3 of Ontario's long-term care homes participating in this program. So about 40% of the, I believe it's 600 and something long-term care homes across the province. Majority of these homes are located in the GTA in southwestern Ontario, but that being said, we do have a spread right across the province. So quite, for such a short time, we've really been able to reach lots of homes in the province and are continuing to onboard. We just onboarded our 11th cohort last week, so very proud of that work. Next slide. So as part of the implementation of these pathways, we do use a systematic implementation approach. So there are currently 11 clinical pathways or topics that you'll see on the screen here. And because we are considering each of these pathways to be best practice guideline implementation, there's implementation activities that need to happen before we go live or start using these pathways. So depicted on the screen, you can see the pathways divided into groups. So we would implement each group one at a time, and typically the home would successfully implement all 11 clinical topics over a 3-year period. And 75% of the homes in the program are somewhere between group 2 and group 3. So actively working here in the middle. Now, to note, this image is a bit outdated. Our dementia and depression pathways that we're speaking to today are not going to be released until this spring. So nobody has started implementing these pathways to date. So next slide, I'm going to start by just sharing a couple achievements to date or outcomes that we've seen thus far. So between April 1, 2023 and March 2024, over 3,500 residents were screened for risk factors on admission using the RNAO screening protocols. So these protocols come from the recommendations within each of the best practice guidelines for a clinical topic. And that means that residents are receiving evidence-based care from the onset of their transition into long-term care, which is quite astounding. You can see that we've had several pathways completed over this time, and really over 30,000 residents are receiving evidence-based care as a result of implementing these clinical pathways. On the screen in the middle, oh, sorry, Joanne. In the middle here, I just wanted to point out the pain and delirium clinical pathways have had the highest utilization rates, respectively, which is hugely significant because it means that we are creating prevention plans to support those that live with risk factors for developing delirium, and we're having comprehensive pain assessments, which means that residents are receiving timely care for their pain needs and outcomes related to pain. Next slide. Wonderful. So some more achievements to date, some statistics from 2023 really showing the impact of implementing the delirium clinical pathway. So on our left-hand side is cohort 2 that consisted of 20 long-term care homes who submitted baseline data from February to April 2023. So we always review key indicators for 3 months prior to the use of the pathway. And you can see on the screen that very few residents were being screened for delirium risk factors on admission. These homes implemented the admission clinical pathway in May 2023. And as you can see, there was a 99% increase in the number of residents who were being screened consistently post-implementation. And we saw similar results for cohort 3. So our graph on the right-hand side, there was 13 homes in cohort 3, one of our smaller cohorts, and we see 100% increase in the number of residents being screened for delirium risk factors on admission post-implementation. Another really great achievement as well is that as part of that admission process within those screening protocols, we also look to screen for falls risk. Now, despite the level of risk somebody might have, whether they're at risk or not, we implement universal falls precautions for 100% of the residents. So all the residents admitted into long-term care homes across the province using these clinical pathways have universal falls precautions embedded into their individualized care plan at the time of admission. So each of these clinical pathways really do live with the foundation of person and family-centered care. The RNAO best practice guideline for the 3Ds, the delirium, dementia, and depression, older adults, really advocates for compassionate, dignified, and culturally sensitive care. It encourages therapeutic relationships and holistic assessments. Recognizing that the PIECES approach is also a familiar best practice in support of older people living with complexity and associated needs in behavioral expression. As Joanne mentioned earlier, RNAO reached out to PIECES Canada to collaborate. The PIECES approach aligns very nicely with RNAO's goal of enhancing the quality of care through evidence-based practices that prioritize the well-being and autonomy of older adults living with dementia. So now we get to the dementia and depression clinical pathways. So I want to provide a sort of brief overview. So we know that there is a huge impact of dementia and depression in the long-term care sector. And so that was why these two clinical topics really were important to be developed as part of this program. We are thrilled to share that the PIECES 3-question template has been integrated electronically into Point Click Care in association with these two new pathways. And these pathways will be launched spring of this year, which is super exciting. Again, they were developed in collaboration with a team including RNAO, Point Click Care, long-term care content experts, and our external partners. And they really do address the need to screen for and comprehensively assess individuals living with dementia and depression. So these pathways allow the home to differentiate between delirium, dementia, and depression and prioritize interventions accordingly. Again, the core principle of each of these pathways and all of the RNAO clinical pathways is a resident and family-centered approach to care. Each pathway directs the nurse to review risk factors, identify signs and symptoms, consider contributing factors, explore the impact on the resident and their family, support the resident and the family-centered plan of care development, guide further assessment and diagnosis, and identify residents living with complex needs who may require further assessment and intervention. This then leads the opportunity to refer to the in-house PIECES practitioner for completion of the PIECES 3-question template in collaboration with all the members of the interdisciplinary team. The RNAO Delirium, Dementia, and Depression BPG reinforces the importance of person-centered care and reduces things like agitation and antipsychotic use. The PIECES approach to holistic, person-centered clinical assessment and care planning in support of the older adult living with complexity, including dementia and depression, is well recognized. Both the RNAO best practice guidelines and the PIECES approach align with and support critical Ontario legislation, which is listed here on the screen. So I spoke a little bit about how we use a systematic, structured approach to implementation that is based on implementation science. So we do use two complementary frameworks to support and move the knowledge into practice. We use our knowledge to action framework and our social movement to action framework. And these are the topics that we really use to guide our implementation approach. We also have coaching. So we have implementation specialists that support long-term care homes with each phase of the implementation journey. And that really allows for support one-on-one as well as group-based coaching. We have education resources and e-learning opportunities and a very comprehensive implementation guide. So RNAO provides some change management strategies and support as homes walk through this program as well. So I just wanted to share some key testimonials from residents and families living in a clinical pathways home. So in the top left-hand corner, I feel I am highly involved with decision making and comfortable to tell staff what I like and dislike. I wonder why they know the things I wonder why they know the things that I like. I feel so comfortable here thinking I'm in a hotel. We appreciate how much information about access to care services and our involvement with her plan of care. We feel at ease knowing that our mom is able to get the care that she needs. So just some really huge impactful statements here. I don't know if I mentioned earlier, but within these pathways, we actually have integrated care planning. So when we see things like I feel highly involved in decision making, it's because these pathways actually allow for nursing process to occur naturally. So the staff will ask questions within the assessment and based on resident responses, care planning items will open up during that time. So it makes the process very resident-centered and a very resident-centered approach to care when we're talking about individualized care planning, prevention planning, utilizing strategies when we're doing that risk assessment. So it really allows and really speaks to that process and how well that's working across the homes using these clinical pathways. And then the next slide is some testimonials from staff working at a clinical pathways home. Being able to spend the right amount of time, I get to know the resident fully well, and it creates some kind of connection. It helps me build a more personalized care plan. So again, speaking to those personalized, individualized plans of care, but also the undertone for that therapeutic relationship. So we're seeing the impact that this is having in homes across the province. And then a quote from a PSW: care plan is detailed and easy to follow. It helps and makes it easier to provide care for the resident. So again, we can see that impact of having individualized care plans where we've spoke to the resident and their family. We've had discussions using the assessment to guide that holistic conversation. And then we've built an individualized care plan that the care staff actually understand and can actually, care for that person in a way that's meaningful to them. So we really look forward to these guiding principles and the outcomes we've seen thus far with the clinical pathways that have been implemented. We look forward to carrying and seeing the success of similar areas with the dementia and depression clinical pathways, and the ability to really identify those living with complex needs, allowing for the interdisciplinary team to really consult with that PIECES practitioner, have discussions about those complex needs, develop individualized care plans that really impact and improve resident outcomes. So with all that being said, really looking forward to this next phase as we move for these being available this year and starting the work to implement these pathways in homes across the province. I'm going to hand things now over to Pam.
Wonderful. Thanks, Brittany. Just super. Now, for those of you who are PIECES educators and others who have familiarity with the PIECES approach, particularly over the past 5 years, this segment here will not be new. However, because the PIECES approach underwent a significant redevelopment, was relaunched in January 2021, and there have been further enhancements since that time, it's really valuable. It's important that we have a current and a shared understanding of what the PIECES approach is all about. And we use this visual to, in the glance, capture the absolute key message. And the why, of course, that drives the PIECES approach is the best possible care for older persons who are at risk or who are living with a broad, and that's really important, a broad spectrum of complex chronic conditions where there are often multiple co-occurring diagnoses and changes in behavioral expression. And that could be associated with neurocognitive disorders, including but not limited to the dementias, mental health and substance use disorders. It could be other neurological conditions, physical health conditions, any combination. It's a respectful, honoring approach, always beginning with the person and care partner and including all members of the team. And you look at that center part of the heart. And this alignment, as Brittany has mentioned, is foundational to the partnership between PIECES Canada and RNAO and this exciting work together. And what will help influence the best possible care is the PIECES 3-question templates, that second heart. However, and this is a critical message, the PIECES approach is more than just a clinical assessment framework, which is how historically it was understood. And it's much more than the PIECES acronym alone. And again, historically, and even, to some extent now, there are those who understand the PIECES approach primarily and sometimes only in terms of the PIECES acronym. And this is an essential message because how the PIECES 3-question template is applied in practice, that's what really matters. This has been the most significant evolution over time because it's about doing with rather than doing to or for, where shared assessment is driven by authentic engagement, and that engagement focuses on the quality of the relationships, beginning with the person, with the care partner, including all members of the team, that outermost part of the heart. And when applied in practice, the PIECES approach guides an evidence-informed and a continuous process for collaborative clinical assessment and care planning that is emotion-based and driven by what matters to the person. It supports optimum health through a focus on prevention, a focus on early detection, on monitoring progress, and minimizing disability. And it recognizes that, as we all know, assessment is a very dynamic and it's an ongoing process. And PIECES has evolved so that it's practical, it's versatile, it helps the team to focus on priority concerns, assessing and prioritizing associated areas of risk and the degree of those risks, prioritizing assessment of possible contributing factors, and developing a priority action plan. And this is essential, particularly when there is complexity. And many of you are aware of the PIECES practitioner role, but again, it's important that we have a shared understanding. The PIECES practitioner works in collaboration, always in collaboration, to engage and help mobilize the team in the shared clinical assessment and supportive care planning, especially when there's complexity and there's risk. The PIECES practitioners are nurses, they're physiotherapists, they're occupational therapists, social workers, and other health professionals with a clinical scope of practice. And the role is developed through the PIECES Learning and Development Program, which is an evidence-informed, highly interactive, and practical 2-day program that is delivered by certified PIECES educators. Now, today, we really want to reinforce that this exciting collaboration with RNAO and the integration of the 3-question template has not changed the role of the PIECES practitioner. What it will do is help to further support and strengthen the PIECES practitioner role in practice and in collaboration. Not every regulated health professional within a long-term care organization will become a PIECES practitioner. However, every long-term care home should consider having PIECES practitioners to support the best possible care for those residents, especially those who are living with complexity, who are living with risk. Now, PIECES Canada, you'll see referenced on the slide. We're thrilled that the PIECES Learning and Development Program is one of the 5 best practice learning programs included in the Behavioral Support Ontario Specialized Training and Resources Program. It's also known as the 5-star programs. The other 4 programs are BSO Foundations, You First, Gentle Persuasive Approaches, and Dementiability. And each of these evidence-informed programs are founded on the principles of person-centered care and emotion-based care. And the PIECES Learning and Development Program focuses on comprehensive clinical assessment. So we've included in chat, thanks so much, Joanne, the link to information about the 5-star programs for you if you're not aware. And we've also included a QR code on the slide so you can get more information. Now, long-term care homes who currently have PIECES practitioners already have processes in place to engage them in a variety of ways, and in collaboratively mobilizing the team and applying the PIECES 3-question template so that it helps to guide the assessment and care planning. And that could include, in the moment, using the PIECES approach, the 3-question template to guide in the moment conversations, used during team huddles, in care conferences, prioritizing urgent assessment and care planning, among others. And the Dementia and Depression Clinical Pathways, which is really exciting, will further build on what is already in place, further build on the partnerships that already exist, including with external partners. And this is really exciting because within the Dementia and Depression Clinical Pathways, the connection to the PIECES practitioner is clearly identified. And the question is asked, based on the findings so far and the person's complexity and risk, should there be a referral to the PIECES practitioner, who already may be involved, but they may not be involved at this point. And with the PIECES practitioner and in collaboration, determining if further assessment using the PIECES 3-question template is necessary at this time to understand that the needs of the person. So building on what is already in place, this will provide yet another opportunity to flag when there is significant concern requiring the use of the PIECES 3-question template. So that's great. It will also further support long-term care homes in the engagement of all team members in the shared assessment and care planning. Terrific. And when engaging other essential partners, such as BSO team members, BSO mobile teams, specialty geriatric services, for example, when the PIECES 3-question template has been completed, it is invaluable because it informs the collaboration in a really meaningful way and informs the information sharing from the outset. And many of these practitioners and organizations are familiar with and use the PIECES approach in their own clinical practice. And when we were working alongside our RNAO partners in the integration of the 3-question template in order to operationalize it in a digitized format, making sure that it was user-friendly, additional cueing and information have been embedded at the same time as ensuring complete fidelity to the 3-question template. And we're confident that existing and new PIECES practitioners in long-term care homes and their partners will really appreciate having this digitized format. Now, the PIECES practitioner is not alone. This is about team and collaboration. So to support PIECES practitioners in engaging the full team when using the PIECES approach, we've developed the Team PIECES in Action resource package. Now, PIECES educators will be very familiar with this resource. Some of you may not be aware of it, so we're really excited to share it, and for those who are aware of it, to reinforce the use of the resource package, because it's a valuable team resource. It will be an invaluable tool for long-term care homes when implementing the dementia and depression clinical pathways. And this resource package is being designed very, very specifically to support meaningful and proactive team collaboration that includes the person, the family members, care partners, PSWs, activation, dietary, all members of the team, all of whom have essential information to share. So within the resource package, the PIECES 3-question template is being translated into what are conversational questions, and so as to foster active and informed participation of all team members when using the PIECES approach. It includes 3 complementary resources intended to be used together. The first, and you'll see on the screen, is a PIECES information sheet that can be shared broadly, a PIECES poster, which is a visual of the PIECES acronym, and a PIECES pocket card, and with those conversational questions. So we really would love it. We encourage you to have a look at the resource. It can be downloaded for free from the PIECES Canada website. So with that, I'm going to turn it over to you, Joanne.
Thanks so much, Pam. So to quickly summarize where we have landed today, The RNAO Clinical Pathways and the PIECES approach together support the best possible care. So both are recognized and established evidence-informed best practices. They fully align with and build on what is already in place, which Pam and Brittany have spoken to this afternoon. And that includes, but it's not limited to, the inter-RI, and also collaboration with BSO teams, PRCs, seniors mental health, specialty teams. Both also support the best possible care and do so by promoting a person-centered, holistic approach that meaningfully and authentically engages all team members. And it focuses on promoting optimum health, minimizing risk, and preventing unnecessary disability while always including the person and the family care partner. Now, by having the PIECES 3-question template integrated in association with these RNAO clinical pathways, it will further support the development of and collaboration with the PIECES practitioner role and the implementation of the PIECES approach. And that is certainly going to support its sustainability over time. And equally important, even though it's number 6, is that these both support informed, standardized assessment and care planning that is consistent with long-term care policy expectations for quality care. So in a nutshell, that is where we have traveled today. And let's look a little bit now at going forward and consider some possibilities. And I would suggest that it is never too early to begin planning, and it is never too early to start to provide support. So many long-term care homes can implement the dementia and depression clinical pathways beginning in the spring, and others will follow as the year progresses. So with the implementation of these new clinical pathways, we do expect that there will be some increased requests for the development of PIECES practitioners. And the majority of us who are here today, we have a role to play in supporting the best possible care of older people in Ontario who are living with complexity. So let's think about how we can work together wherever we stand to support long-term care homes as they operationalize these pathways and the PIECES approach and build on what is already in place. So it would be terrific if you could begin by having conversations. And if you're in an external support role, connecting with long-term care homes that you support in your region and asking if they're currently part of the RNAO Clinical Pathways program is a great first step. Considering if implementing these pathways would have an impact on regional capacity enhancement planning and what that might mean as a go forward. And also consider in your individual role and in partnership the possibilities for supporting long-term care homes to be successful as they move these pathways forward. Now, for long-term care homes who are currently participating in the Clinical Pathways program, it might be helpful to start considering, are there ways to further mobilize the PIECES approach and enhance the connection to the PIECES practitioner, the team collaboration with the PIECES practitioner? And also to think about enhancing those connections with external partners who support education and clinical assessment. There might be some conversations to have there. Now, as always, PIECES Canada will continue to work in collaboration with PIECES educators, with regional leads, and as we move forward and the need for the development of PIECES practitioners is better understood, we will remain connected with you. We also continue to offer educator teams the option of opening unused seats in a planned PIECES Learning and Development session so that they can include learners from elsewhere in the province. And in the Southwest region, for example, a small number of seats are allocated for provincial use in most learning and development program sessions that take place. And me, Ray, and Chris, they're with the Southwest BSO operations team. They've just been fabulous to partner with in this proactive planning. And they have said they would be happy to discuss their experience with any educator teams or regional capacity enhancement planners. If you know me, Ray and Chris, feel free to reach out. If you would like to be connected to them, send me an email. I'll give you that at the end, and I will make sure that we can connect you up with the Southwest team. So there are other options that we are also looking at to optimize seat utilization wherever possible. And we will also remain connected with and partner with RNAO so that we can better appreciate the need as it evolves and as this project moves forward. We can support the development of PIECES practitioners, and we can continue to share vital information to long-term care homes or to partners, external partners like yourselves, so that you're abreast of where things are going as they unfold. So we would like to hear a little from you, and the many of you here today are working with long-term care homes. Some of you are external partners and you're supporting long-term care, and that might include clinical support, education, capacity enhancement planning, or policy development. We would like all of you just to consider for a moment where you work, your role, and building on what is already in place, what possibilities do you see? Um, will you consider going forward? And we do have a short poll that we would like to we will make available for you to tick any comments or statements that you think might be a possibility for you moving forward. So it's terrific to see that the possibilities that you're considering. And we hope that the information that we've provided today has been helpful and that it has inspired you, and as you move forward with some next steps. We thank all of you for joining us today, and it was our pleasure to share this information with you about this exciting collaboration and the work to support the best possible care. So please feel free, if you have questions after today, to reach out to Brittany or myself. And next week, you will receive an email from the PIECES Canada office that will provide a copy of the PowerPoint slides, a link to the recording, and will also include a list of the long-term care homes that will be actively implementing the dementia and depression clinical pathways starting this spring in 2026. So we're now going to end the recording, and we will open the webinar up for questions. So just give me a moment while I find that recording button and we shut this down. And we will